How long does it take to recover from a rhinoplasty or nose job? Rhinoplasty is a surgery that causes a lot of pressure, sometimes some sinus pressure, and sometimes some surgical pain. How long it takes to recover is really individualized, but I'm going to give you some parameters that give you a reasonable range. How painful is this rhinoplasty recovery? Patients ask me, well, how much will my pain be? I can't really tell them, but I can tell them that most of my patients stop taking pain pills at 48 hours after surgery. Do I need pain relievers after a rhinoplasty? I give enough pain pills for about 5 days, typically, unless the patients are really eating them like crazy. Quite typically, they've stopped taking a lot of pain pills a day and a half to 2 days into it, and on the third day, they're only taking Tylenol. For me, that says that the recovery after this is not too painful. The first night may be uncomfortable, but it's not too bad. The length of time that it takes to recover is based on how you look at it. Certain things are part of your recovery. I don't like you to work out, lift weights, do strenuous exercise for 3 weeks. That's part of the recovery. I like you to avoid a lot of crowds, be it concerts, be it plays, be it things where there are a lot of people outdoors, where somebody can bump your nose for about a month. The splint comes off from a rhinoplasty at a week. The sutures come out, and the internal splints, I don't use packing, come out at a week. The basic recovery is done then, but the longer recovery is the fact that your nose is a little numb on the tip for a few months. You have some swelling that obscures a little bit of the final outcome for several months, up to 15 or 18 months, but not a swelling that most people can see. When you talk about how long it takes to recover from a rhinoplasty, it depends on how you look at it. For most of my patients, they feel 85 or 90% recovered at a week to 10 days. But once in a while I have a patient that says, it took me a month to recover. Part of it is how they expect and what their perception is of the surgery, how they listen to me beforehand. If you think you're going to have a little bit of swelling and you have a little bit, it's what you expected, it's not so bad for you. So I try and have a pretty open communication with my patients at their preoperative consultation and at their preoperative history and physical, their pre-op visit, so that I answer all their questions. If you have questions about rhinoplasty or anything else relating to your face, call me. You can email me, you can call me directly, or certainly you can come into my office for a consultation. I think that's the start, that individualized consultation to you getting your best outcome. I look forward to seeing you.